So the 7 principles of naturopathic medicine, huh? That's what you want to hear about. Okay. First of all, the healing power of nature. That's the first principle. Vis medicatrix naturae. Well, there are 2 aspects, not just one. It isn't just the healing power of nature, it's also the destructive trend of nature. So nature has within it the healing power, so it has a regenerative piece. If given all of the materials and aspects that it needs to regenerate itself, nature will always do that. It'll bring itself into a new level of order. But on the other hand, there is a destructive trend as well. I've used in the past the example of the forest. Beautiful canopy, strong, beautiful forest, growing, producing seeds. That's the regenerative phase. But that regenerative phase is built on the roots that are rooted in a deteriorative phase. And that deteriorative phase is the phase of rot, the rotting wood, the carcasses of dead animals, the droppings of animals, all of that gunk is that phase that fertilizes the transformative and beautiful phase of nature. So, understanding both of these, the catabolic and the anabolic phase of living systems, is an important rule for naturopathic medicine. Secondly is, first, do no harm. Well, even in the practice of regular allopathic medicine, this is a major and important rule. So whatever medicine we prescribe, whatever treatment we prescribe, we want to first make sure that we're not going to harm the patient by that treatment. Now, sometimes with any treatment, surgical or prescriptive medicine, there is always a risk factor, risk of side effects, risk of injury, etc. What we want to make sure is that what we're doing to treat the patient, that the value far outweighs the risk in bringing that patient to a level of wellness. So that's what that rule is about, making sure that our treatment has value and that value is greater than the risk involved in the treatment. Thirdly is find the cause. So finding the cause is imperative on the very next law, which is treat the whole patient. So to find the cause of any disorder, pain, inflammation, whatever is going on with a patient, autoimmune disease, cancer, we really have to look at the whole patient. And we have to see the whole patient in a contextual way. We have to see them in the context of their family, socially, economically, familially. We have to see them in the context of their belief system. We have to see them in the context of their lifestyle, their exercise regimes, their diet, etc., and understand that context and be able to work with them within that context. And so finding the cause means that the causative factors may be involved in every single one of those factors. And we have to help the patient discover what those factors are, and we have to tweak them and work with them so that we can bring them to a place of wellness. And then once we get them to a place of wellness, then the very next principle of naturopathic medicine comes in, and that's prevent disease. So we have to help educate our patient on what is wellness and how to maintain that wellness so that we can prevent disease. We have to treat the patient not only today, but we have to treat them for tomorrow, and we have to treat them for the next year, and 5 years, and 20 years. So it's seeing the patient in the context of a timeline, and that's the way you practice preventive medicine, changing the trends that are happening now that are pointing to disease in the future so that we can change those trends to point to health in the future. That's a very, very important part of practicing medicine. Now, that requires the very next principle in naturopathic medicine, and that is doctor as teacher, because we have to teach our patient how to change their lives and give them the ways in which to do that so that they can change these trends towards illness into trends towards wellness. And we also have to have a patient involved in making decisions about their health care and about their life. And those decisions have to be made as informed decisions. So I don't like when my patients make random emotional decisions based on random emotional responses to things. I want them to make informed decisions based on evidence, peer-reviewed medical evidence, data, statistics, as well as their internal intuitive milieu. So what I tell my patients, for instance, is when you have to make a decision, you make it on 49% fact, data, and evidence, and 51% on what your gut tells you is right for you. And then lastly, in all of this, we have to maintain wellness. So we have to, as teacher, help our patients learn what wellness is and how to go about maintaining that wellness. Those are the 7 principles of naturopathic medicine. Thank you.